Hi, this is Dr. Kingston, and in this video we'll be discussing the vascular supply of the orbit. The objectives for this video are to trace the branches of the ophthalmic artery and vein, and then to describe the relationships of the orbital neurovasculature within the cavernous sinus within the cranium. The arterial supply for the orbit comes from the ophthalmic artery. The ophthalmic artery is a branch of the internal carotid. So here's the internal carotid and here's the ophthalmic artery. It's going to branch off that internal carotid right as it emerges from the cavernous sinus. It's then going to travel with the optic nerve through the optic canal and into the posterior orbit. Once it arrives in the orbit, it's going to start to give off branches. The first branch that it gives off is the central retinal artery, and this one is a little bit different from all the others. It's going to pierce the dura that surrounds the optic nerve, and it's going to travel through that optic nerve to reach the eye. The subsequent branches that come off then are going to share the names of branches of V1 that they run with. So we have a lacrimal artery, we've got a supratrochlear artery, and if I had a little bit more on this picture here, we would see a supraorbital as well. There are two ophthalmic veins that drain the orbit, and these are both going to drain into the cavernous sinus. So the cavernous sinus, remember, is this cranial dural sinus that runs right next to the sphenoid here, and then will eventually drain by the inferior petrosal sinus down to the jugular vein. The superior ophthalmic artery, so this one here, is going to drain the superior orbit, the eye, the ethmoid air cells, and even a little bit of the forehead. It also has connections to the facial vein via the angular vein, so that's the one that runs right up to the bridge of the nose there. The inferior ophthalmic vein, this one down here, is going to drain the inferior orbit and part of the face. It also has connections to the facial vein and also down into the pterygoid plexus of veins that sit in the infratemporal fossa. These connections are important to remember because they can be a pathway for infection to spread. And they're especially important here because those ophthalmic veins drain directly into the cavernous sinus, which sits around the brain inside the cranium. Now that cavernous sinus also has some important relationships to the nerves that supply the orbit as well. So in this picture here, we can see the cavernous sinus within the dura. And in this image here, the dura has been peeled off, so we can see the pathway that these nerves travel. So traveling through parts of the cavernous sinus, we have the oculomotor nerve, the trochlear nerve, the ophthalmic nerve, the abducens nerve. All right, I've included maxillary here because you can see it. So that's V2. Ophthalmic, remember, is V1 right there. Now, some of these are going to travel through the wall of the cavernous sinus. And if we look down here, we can see which ones those are. We have the oculomotor nerve, trochlear nerve, ophthalmic nerve, and a little bit of the maxillary nerve as well. The abducent nerve is a little bit special. I should say, we're going to call this the abducens. Some texts call it abducent, as you can see right here. We're going to stick with abducens. And that travels right through the sinus itself. So it is bathed on all sides by blood. So if you were to get an infection in your cavernous sinus, it would most likely affect your abducens nerve first. I will note too that all of these nerves might be affected by an infection within the cavernous sinus. We call that a cavernous sinus thrombosis. The ones that are traveling through the wall are just likely to be affected after the abducens nerve. All right, I have given you guys so many hard practice questions for this session that I'm going to end it with giving you an easy one. And the correct answer is C, the central retinal artery. This is the branch of the ophthalmic that is going to pierce the dura that surrounds the optic nerve and travel right through its center to enter the eyeball. And that is the end of that. Thank you guys for watching.